Another surgery you may need is a sentinel lymph node biopsy. Can you explain what that is?
Yes. So one of the things that we know is that melanomas would begin in the setting of a mold damaged by the sun. It'll grow in place, and then for some melanomas, they can get into the lymphatic channels and spread to the regional lymph nodes. Let's say, for example, you have a melanoma in the forearm. The regional lymph nodes here would be the axilla, the underarm. If you have a melanoma, for example, in the lower belly, the regional lymph nodes would be in the groin. So the procedure here is designed to detect if that melanoma is spreading to the lymph nodes. I'll give you some numbers. Thin melanomas, the ones that are 1 millimeter or less in thickness, the chances of going to the lymph nodes is very low, less than 5%. So we don't actually check the lymph nodes for those.
Right.
If you have an intermediate thickness melanoma, 1 to 4 millimeters in depth, the chances of going to the lymph nodes is 18%. So we do care about that, and we do check the sentinel lymph node biopsy. And then likewise, the thick melanomas, more than 4 millimeters in thickness, they have a 50% chance of going to the lymph nodes, so we need to know that. We need to know about the lymph nodes because that would determine if you need more treatment in addition to surgery.
What kind of follow-up is a patient looking at with either surgery?
Yes, so if you have the sentinel lymph node biopsy and it's negative, basically, you go back to your dermatologist and have the full body skin exam at 6-month intervals. If that sentinel lymph node biopsy turns out to be positive, the follow-up is much more aggressive. You usually have to get a medical oncologist involved. They are going to do some imaging testing, usually called PET scans, that look at your whole body for other areas of metastatic disease. You might need to be enrolled into other treatments like immunotherapy. And then even for me as a surgeon, those patients that have a positive sentinel lymph node, I follow at 6-month intervals to check on their lymph nodes again. Basically, we do a physical exam and an ultrasound, and if we see a lot of disease coming back, then more surgery might be indicated.